Dr. Hansen, good to
Hey,
see you.
good to see you too.
Been with you for a couple of weeks now, and seeing what you affect your patients with spinal alignment and taking care of their whole entire body and their whole health history as a unit has been super inspiring. And honestly, you've been a great role model for me. How to treat patients, how to talk to patients, how to make them feel comfortable, and how to make them open up and realize that their entire health is corresponding to how their spine looks on X-ray. Well, we're in the X-ray room here. So
Awesome.
if you could talk to us a little bit about how you approach patient care and how you get them to understand that their whole entire health is consistent with how they treat themselves on a day-to-day basis.
That's a deep question. Now, patients coming in, it's really working with patients. You kind of see two types of patients walking in because you got one group of patients that already kind of understands that philosophy. They understand that the brain controls the body through our nervous system. So it sends the information down through our spinal cord or basically through our spine, which protects the spinal cord. But that goes all the organ cells and tissue of the body. There's a constant feedback loop of information. So as long as the brain is communicating with the body, they stay healthy. So they understand any interference to that is going to affect their overall health. So in a patient like that, it's really easy just to go assess them. They kind of already understand how the body works. The ones that are troubles, you get patients that come in that are very based on a Western philosophy of medicine where they're used to having a symptom and then something comes in and they do some kind of a procedure to handle the symptom, medication, surgery, whatever. And that's really not the case. So what we're going to do is try to educate those patients on how the body works and what's it really going to take to get them healthy. And so that's where it really takes sitting down and talking with the patients and working with their mindset.
Beautiful. And since we're in the X-ray room specifically, what do we see on X-rays with patients? And some patients, they might be a little bit worried about getting their X-rays or things like that. What do you see X-ray provides to your care and how you're able to treat that patient more specifically?
Well, you really can't you can't understand a patient without seeing their x-rays. The x-rays are that picture into their overall health. I can see where there's degeneration, autoimmune disorders. You can see where the body is physically degenerating from prior injuries, affecting nerve flow to different body parts. Also, you can see postural deviations, weakened curves, and you get overall expression of how their overall nervous system is doing. And you get a huge amount of information from those x-rays.
And on posture specifically, how come we feel so bad after sitting at the desk for a long time? Why do we have so much neck pain when we're sitting? So what if our body's forward, right? But it actually has a long-term effect on what
Absolutely.
we're doing.
Our bodies aren't meant to sit. Our humans are not meant to be sitting beings. Our body is not stable when we're sitting. When we're sitting, there's 300% or 3 times more stress going into the joints of our low back. It changes our posture. The pelvis is weak. It's not in a stable position. So when you're sitting, you get in these positions. The body is designed with their proper posture to be effective against gravity. The curves are supported with gravity. The balance, everything is nice and relaxed on our body. When we're sitting, we get in these abnormal positions where we're being pulled with gravity. Our body has to fight against that all day long. That's why by the time end of the work, you get fatigued, you're sore, we start to deteriorate. Now there's abnormal stress. Bones start to change because they're trying to make themselves stronger. And that's when we start to see problems. So it just kind of snowballs their health effect.
Let's get ourselves first and then our patients back into overall health and alignment.
Oh, absolutely.
Thank you so much, Dr. Hansen, for your time.
Oh, definitely.
Really appreciate it and all the things that we've learned from you. So thank you so much.
Oh, definitely.
Appreciate it, Doc.
Wonderful. Thanks so much for
Thank you.